I'm Dr. P.C. Gupta, heading the Department of Vascular Endovascular Surgery, Interventional Radiology and Podiatric Surgery at Care Hospital in Banjara Hills. It's a comprehensive collection of specialists who are able to provide the right sort of care to patients with vascular problems. And today we are going to discuss a very important problem, diabetic foot and its complications. With me is Dr. Radhika, who is trained in plastic surgery and then in podiatric surgery, just the perfect combination to manage patients who have problems related to diabetic foot. So, Dr. Radhika,
Yes.
let me start with, we spoke about preventing diabetic foot earlier, but if a patient gets an ulcer or what we call a diabetic foot and it is neglected, what can go wrong?
Yes. If the patient has a diabetic foot problem or an ulcer, which has been there for some time, problems are it can get infected at some point of time, which can lead to loss of limb or sometimes the loss of life. And if not otherwise, if the patient has decreased blood supply, that wound may not heal at all without right attention.
So, in the clinic, what are the common complications that you see in patients with, let's say, advanced diabetic foot?
Yes. Usually what we see with advanced diabetic foot disease, infected diabetic foot ulcers and gangrene of toes and or partially the foot gangrene, and with advanced loss of sensation it can be even charcot foot, where there is damage to bones which is continuously happening because patients can't feel that they're walking with a broken bones inside.
Yeah. So these are feet that look really unwieldy and abnormal and can result in huge complications for patients. So what is the indication, Dr. Radhika, that it is no longer just a simple ulcer, but a major problem and possibly an emergency?
Yes. Whenever patient has a diabetic foot ulcer, if you are developing fever, smell from the wound, or sometimes people even say, I have fever only in my leg, that means that the ulcer is getting infected. These are the things which indicates then it is a medical emergency and no longer you can do the dressing at home.
Yeah. So in technical terms, we talk about presence of an abscess, which means collection of pus, or we talk about wet gangrene, which means there is not only is there gangrene, but also that gangrene is now infected and the infection is spreading. So sometimes patients, when they come to us, they have, let's say, a gangrene of the toe, which is looking little wet, and we think that the toe should come off immediately. Patients want to think about it since they're going to lose, let's say, part of the body. They come back 2 days later and we find that the infection has gone to the middle of the foot, sometimes up to the ankle. Why does that happen?
Yes. Any infection, if it is left untreated, it spreads along the tissue surrounding the toe. Usually it spreads along the tissue planes like what we call as tendons and neurovascular bundles. It keeps going up. Especially in foot, what happens is whenever you put your foot down with infection, because of the closed spaces inside, infection will fastly spread up.
Yeah. And of course the immunity is low in these patients. I remember when I was a registrar in Chandigarh, we had a patient who had some gas forming organisms resulting in severe infection. It was E. coli, and we advised a below knee amputation, and the family decided to take some time, and 4 hours later the infection had spread above the knee, and we ultimately ended up doing an above knee amputation, just a matter of 4 hours. So we work together as vascular surgeon and podiatric surgeon. So obviously you will see a lot of patients who have reduced blood flow.
Yes.
Not only a simple diabetic foot. How does this complicate matters for the patient, and how difficult does this make things for you?
Yes, very rightly put, sir. Usually we see patients with different problems. Whenever we see with only infection, if you just remove that part of infection or part of the foot, infection will stop spreading and wound will heal gradually. But when they have reduced blood supply, whatever we do, that wound is not going to heal. For me, in diabetic foot, 2 important procedures are always proper debridement and revascularization, which means increasing the blood supply to the foot so that the wound heals better.
Okay, got it. So if a patient has, let's say, infection and decreased blood supply, what would you tackle first?
Yes. Whenever we see any patient with foot problem, always see if there is infection or decreased blood supply. If the infection is bad, tackle the infection first, and then to help the wound heal better, increase the blood supply.
Okay.
Either toe first or flow first will depend on infection level or the vascularity issue.
Right, got it. So, if a patient comes early, can we avoid an amputation?
Yes, definitely yes. When the patient is seen at right time, we can definitely prevent major amputations. Small ulcer can be treated at that stage. In these situations, what becomes more important is understanding the reason for the problem. Either it is decreased blood supply or because of the foot deformity. If it is a deformity which is causing the ulcer, treat that. If it is the vascularity which is the issue, increase the blood supply. Identify and treat the root cause, and yes, we will be able to prevent amputation.
I think very rightly said. I think another thing that patients need to understand, sometimes when there is toe infection or toe gangrene, the bone is infected, while sometimes we can save the toe by removing the infected bone, and that you do that quite often. It is okay to lose a toe if it really needs to go in order to save the rest of the foot and to be able to walk. Similarly, there are times when half the foot needs to go, what we call a transmetatarsal amputation. But even that is worth doing because you can still walk on your heel and prevent what we call an above ankle or a major amputation, which would be either a below knee or above knee amputation. So as we always say, a stitch in time saves 9. So early attention to a problem definitely is going to help you prevent major complications and limb loss. So if you were to give one message to patients with diabetes regarding how they can preserve their limbs.
Yes, like how you go to your endocrinologist for your sugar management. From day one, whenever you are diagnosed with diabetes, please see a foot surgeon or a podiatric surgeon from the beginning and get your feet checked once in every year unless you develop any problem, and later every 6 months. It is the early intervention which helps to save tissue and the limb. So be in regular checkups with your podiatrist.
Yeah. I think many of us don't take preventive steps because there is no disease. So we think for the last 20 years, any diabetic who walks into our clinic, we've been giving or advising preventive care for diabetic foot. How they can prevent these problems, giving them advice regarding foot care, and yet we see the same people coming back with diabetic foot, with complications, some of them ending up with even major amputations. So I think to understand that diabetes can pose a risk to feet and to limb, I think is the most important thing. Anything else you would like to say?
Be educated and be aware of the foot complications. Don't think this will never happen to me. Yes, it is possible. Anyone with diabetes can get affected.
Thank you, Dr. Radhika.
Thank you, sir.
Thank you.
Thank you.